Assalamu alaikum. Hi, Dar Alliance. Welcome to this session. And my name is Bachar Afandi, and I will be talking on the evaluation of the safety of Finerenone used in patients with type 2 diabetes and proteinuria during Ramadan fasting. This research did not receive any financial support, and the authors report no conflicts of interest regarding this work. Now, as you know, finerenone is a non-steroidal mineralocorticoid receptor antagonist. It has shown efficacy in managing diabetic kidney disease, and it's currently approved for the use in patients with type 2 diabetes in the presence of albuminuria and estimated GFR of more than 25 milliliter per minute per meter square. Now, this study is a retrospective cohort study done in Tawam Hospital and ambulatory health services in Al Ain, UAE. It was done starting July 23 till July 24. And it was approved by our ethical committee. The inclusion criteria for the patients were adult patients more than 18 years old, GFR more than 25, and they are treated with finerenone therapy for the last 10 days at least before the start of Ramadan, which was in March 11, 24. The exclusion, if any patient could not follow after Ramadan, we canceled that patient from the study. And the parameters we followed during that was glycemic control, renal function, level of albuminuria, electrolytes, and we did analyze that pre-Ramadan, during Ramadan, and also post-Ramadan. We did the statistical analysis using the logistic and linear regression. So let me go to the results. Now, we recruited 313 patients with CKD. We divided these patients into two groups. Group one, the patients who were not using finerenone, and that was 271 patients, diabetes, all of them with diabetes, and 240 patients. Out of these 271 fasted the month of Ramadan, 31 did not fast. The second group included 42 diabetic patients. 30 of those observed fasting during last year, and 12 did not fast. Now, these are the baseline features for these two groups. You could see there are many differences, actually. If you look at the finerenone group, you could see that they were more on statin, for example. They were significantly using GLP more often than the group that was not on finerenone. Also, they were on SGLT2 inhibitors more often, and also metformin. Also, here you could see that a little bit more significant on insulin, not significant on sulfonylurea. So as you could imagine, this is a high risk group that already on finerenone. Now, looking at the results, and here we're comparing the two groups, or actually the four groups, the one on finerenone, not non-fasting, finerenone fasting, and here the non-finerenone group also fasting, non-fasting. And you could see easily here, that the group that was fasting and on finerenone has the most incidence of adverse events, 36%, and also they had the most incidence of hypoglycemia among the four groups of these patients. So again, the group that was using finerenone and fasted during Ramadan had more adverse events and also more hypoglycemia. Now here, we used the logistic regression to analyze what are the determinants of hypoglycemia. And you could see many factors here. Some of them had a significant p-value, including systolic blood pressure, and I mean, slightly significant, but however, the only very significant risk factor for the incidence of hypoglycemia was the use of Finerenone. And you could see here that the odds ratio was 85 and very significant. So the most important, or probably the only one here, you could see only blood pressure was significant. The others were, I mean, slightly, I mean, but not clearly significant. The only important one was the use of Finerenone with an odds ratio of 85, and that was using logistic regression analysis. Also, results showed that there is a marginal decline in the eGFR among fasting patients who were using Finerenone, about 4.08 milliliter per minute, and that was slightly significant. 0.06 did not reach significance. A1C also reduced in fasting Finerenone group by 0.1, and that p-value was 0.04. And there was no significant changes in non-fasting Finerenone users or all controls. So only the group that used Finerenone and fasted, they had a slight reduction in their GFR and also A1C. So, I mean, just to go over these findings, we could say that fasting exacerbated the hypoglycemia and renal function decline in the Finerenone users. And there was, of course, as you could imagine, a higher CKD stage to start with in these patients, and they had higher incidence of proteinuria in this same group, and that probably confounded the outcomes. And these findings, as you expect, are exploratory due to the retrospective design and this very small sample size. Limitations in this study are very clear. This is a retrospective design with potential confounding variables. This is a small sample size that limits statistical power. And there is, of course, imbalance in the baseline characteristics. Example, the severity, diabetes treatment, as you saw, the insulin a little different, that might cause the hypoglycemia in some patients. However, the analysis, the regression analysis, showed that the odds ratio is most important for the use of Finerenone. And again, most of these were self-reported fasting practices, and adherence may that might introduce bias. In conclusions, Finerenone used during Ramadan fasting in chronic kidney disease patients might carry risks of hypoglycemia and also renal function decline. And again, these findings are only hypothesis generated, and this emphasizes the need for prospective studies in the future. In conclusions, ladies and gentlemen, comprehensive patient assessment and the use of Ramadan risk calculator can help guide safe fasting practices and reduce the risk of adverse events. As you know, personalized treatment plans and close monitoring are always essential for safe fasting for all patients, especially those with DKD, diabetic kidney disease, specifically those who are treated with Finerenone. These are the members of the team from Tawam Hospital and AHS. I like to thank them all for their support in this work. And this work already accepted for publication, the Journal of Diabetes and Endocrine Practice, which is the official journal for the Gulf Association of Endocrine and Diabetes. And with that, thank you so much. Assalamu alaikum.